Let me be very clear. 2 HSE CAMHS-ID doctors wrote false information about my autistic child in official correspondence, and those false records were then relied upon to deny him treatment. The treatment is prescription medication that costs about €40 a month privately, or €3 with a medical card. The records made by these 2 HSE CAMHS-ID doctors contain multiple misleading details, but I will focus on only 3 in this video. That is how we got here. My son is nonverbal, autistic, and has an intellectual disability. He was on the HSE CAMHS-ID waiting list. After months of unanswered GP requests, and after Dr. Susan O'Hanrahan refused to even listen to concerns about my child over the phone, I wrote formally on April 7, 2025, requesting an urgent assessment or prescription. Instead of responding clinically, her office referred us to West Clare CDNT for support. That did nothing to address the crisis. So I ended up taking my child to A&E at University Hospital Limerick to try to make a case for prescription medicine to help him. When we arrived, the ice cream in his hand stopped working. Within seconds, 5 staff members were trying to help. Once things settled, we were moved to Children's A&E. The attending doctor's first words were, "I don't want to be attacked." That tells you everything. The A&E team did the right thing. They recognized my child needed specialist mental health intervention, not discharge, not delay. He was admitted on 23 May 2025 to await psychiatric assessment and prescription after presenting with autism-related irritability, aggression, ADHD symptoms, and psychosis. Now here's one of the problems. On 10 June 2025, Dr. Susan O'Hanrahan wrote this about why my child was admitted. He was admitted to UHL on the 23/05/2025 as his mother required some medical investigations and his behaviour was such that there was nobody with the skills to support him at home. That statement is misleading, as that was not the reason for his admission. She also recorded misleading details in the same letter about the dosage of aripiprazole. And it matters because it removes accountability for months of delayed diagnosis and delayed treatment. It rewrites the reason for admission. It protects the doctor and the system, and it harms the child. Within 72 hours of admission, my son was prescribed aripiprazole. It worked. For the first time in years, my child was calm and regulated. Hospital staff saw it. I saw it. Anyone paying attention could see it. The gentleman who delivered supplies for the child to the ward saw it. For the first time, my child was at peace. Then came the push to discharge him without that medication and without assessment. I was told assessments couldn't happen in hospital, despite being told the opposite before admission. I refused. If medically trained staff couldn't tolerate for 72 hours what my family had endured for months, why should the child be discharged without the medication that worked for him in hospital?
It was in the child's best interests to remain where medication and support existed until he received the assessment and prescription for home use that he was admitted to get. After a multi-stakeholder meeting that I was excluded from, I was told aripiprazole would be included in his discharge prescription, but the assessment still hadn't happened. With TUSLA involvement, transport was arranged to the assessment venue. The assessment went ahead. At no point did HSE CAMHS-ID's Dr. Susan O'Hanrahan discuss the antipsychotic my child had been given in hospital, or the autism-related aggression, irritability, or psychosis. She prescribed Medicanet, a stimulant. I initially assumed it was because the hospital prescription for aripiprazole was already on his discharge prescription sheet. I was wrong. She retained the discharge prescription sheet. When I asked about the aripiprazole, she said, "He will not be needing that." She sounded angry. For the first 3 days of discharge, my son was like a brand new boy. No scream crying, no agitation, no excessive giggling, went to bed easy, stood at the toilet door when he needed to go. On day 4, he started deteriorating. As the aripiprazole that he had in his system from the hospital left his system, he regressed badly. Between 7th of June and 18th of July 2025, I contacted Dr. Susan O'Hanrahan's team at least 5 times asking for reinstatement of the aripiprazole. It was refused, with varying excuses given. Instead, Medicanet was increased from 5 mg to 10 mg to 20 mg. Let me be clear. Aripiprazole treats autism-related irritability, aggression, mood instability, and psychosis. Medicanet does not. In children like mine, stimulants can worsen agitation. And that is exactly what happened. On 10 mg, my child developed an iron grip. His agitation worsened. On 20 mg, he violently lifted a West Clare CDNT senior clinical psychologist and her chair. The psychologist and the social worker spent the rest of the visit pressed against a wall, afraid to approach him. 60 minutes against a wall. They were running when they left. He broke 3 window handles in one day, which required brute force to do. This was not his baseline. This was medication-induced deterioration. This was O'Hanrahan iatrogenic. On 11th July, after our joint CAMHS-ID paediatrician appointment had been cancelled by Dr. Adela Vatka, when I notified the clinic that we would be arriving late due to the child's psychotic episode that morning, another call came through 20 minutes later, during which I was told that the child needed a blood test by Dr. Vatka and Dr. Hamid. Something never mentioned before.
It sounded like a routine blood test, so I said we'd arrange the blood sample through our GP, as the child was audibly upset and plans had been changed to focus on how to calm him. Our GP was 15 minutes away, and UHL was 35 minutes away. Had the aripiprazole not been discontinued, we would not have had an episode that morning. Then on 16th July, Dr. Hamid rang to tell me that the Susan O'Hanrahan CAMHS-ID team was now ready to give my son aripiprazole, but only if he passed a blood test. He would also have to be taken off the Medicanet. You see, I had previously informed them that the aripiprazole and Medicanet combination favoured the child in the first days back home from hospital. Nevertheless, I was hopeful. Any progress was welcome, as long as it put an end to the child's distress. I later discovered that the GP had already told them they do not do paediatric bloods. The next day, 17th of July, I formally requested aripiprazole in writing again so my child could calmly and safely attend hospital for blood tests. The fax was delivered at 11:16 a.m. 48 hours later, Dr. Hamid told me over the phone that aripiprazole was now off the table. No reason. Just gone. That only confirmed to me that they never intended to give him the medication that he needed, because it would treat the autism irritability and aggression they had left off correspondence and pretended that he didn't have over past 6 weeks. They had been playing with this child's life for 6 weeks since his discharge from hospital. 2 envelopes later arrived in the post. One dated 17th of July 2025 from Dr. Syed Nafai Hamid, denying that aripiprazole had effectively been used, by reframing my request as a trial. Dr. Hamid was pleading with our GP to take a blood sample of the child. Instead of humanely restarting aripiprazole or providing a prescription for another medication that would allow the child be calm enough to have a needle stuck in his arm for bloods at any facility that offers the service, Dr. Hamid sends a plea to the place he knows does not do bloods for children and misleads the GP about the events of 11th July 2025. The second envelope contained a fresh prescription by Dr. Susan O'Hanrahan, dated 18th of July 2025 for Medicanet, the drug that had already harmed the child and continued to increase his agitation. Dr. Susan O'Hanrahan has 30 years plus medical experience. That told me everything. Dr. Hamid's letter of 17th July 2025 and a section of Dr. Susan O'Hanrahan's letter of 10 June 2025 are available on www.TreatingWilliam.com. On 18th of July, over-medicated and distressed,
my 9-year-old tried to walk out of an upstairs window. He thought he was Superman. He could have died or sustained serious injuries as there was a concrete pavement below.
More happened. That day, I stopped the stimulant, as it looked like it was being used as a tool to end my son in a bid to cover up medical negligence and mistreatment. On 21st July 2025, I revoked consent for treatment, because when doctors and HSE employees distort records, they endanger patients. My child is not a narrative to be managed. He is not expendable, and he is not silent because I am not. Why has the University Hospital Limerick, HSE Midwest Disability Services, and West Clare CDNT not provided to me the records that I requested under the Data Protection Act? Is it because some of the records point to collusion to downplay the child's symptoms and to withhold appropriate treatment and care support? Is it because the records will show that the decision to deny the child appropriate treatment was already made before the 3rd June 2025 assessment? My DPA requests to the University Hospital Limerick Disability Services and West Clare CDNT are displayed on the screen and are available to read at www.treatingwilliam.com. Why has the HSE not investigated this matter or responded to my complaints since my first bringing it to their attention in June 2025? Is it because the preferred official narrative is one that means that they will not be reporting Dr. O'Hanrahan or any other professionals involved to the Medical Council and other relevant regulatory bodies? The HSE allowed Dr. Susan O'Hanrahan to withhold appropriate treatment from a 9-year-old autistic child, which kept him in a situation where it looked as if he would never have gotten better if he had been assessed and treated earlier. This removes accountability for delayed diagnosis and delayed treatment from them. Is Dr. Susan O'Hanrahan's conduct HSE-approved conduct, or was she acting against HSE policies? To my knowledge, the HSE has not investigated this matter, and the HSE has not referred Dr. Susan O'Hanrahan and Dr. Syed Nafai Hamid to the Medical Council for misconduct, which says that they are protecting the doctors whose conduct harmed a child and almost cost a child his life. I am sharing this publicly because the HSE complaints system failed, because data protection complaints were ignored, because silence protects misconduct, and because if this can happen to my child, it can happen to yours. Please share this. Please speak up. And if you can, help us secure safe treatment and therapy elsewhere by contributing to our GoFundMe, or contact me at caroliney@treatingwilliam.com if you have advice, recommendations, or other support. My son is nonverbal. I am his voice. Please lend your voice to our cause.